We are live now, doctor.
Okay. Yes. Shilpi.
Yes, sir.
Good evening, postgraduates, and welcome to this Pan India Intercollegiate Postgraduate Quiz, which has been hosted by Brain Teasers in association with Ophthalmological Society of Nagpur, and the event is Big Q. Next. Next, Shilpi, slide. Yeah.
आठ समंदर अपना अंबर
साला तो
खोज
जीतना
ले
ही
अब
नहीं।
तू अपने दम पर भूख मार के धूल झाड़ ले छोड़ छाड़ के सारे छप्पर आठ समंदर अपना अंबर खोज ले अब तू अपने दम पर भूख मार के धूल झाड़ ले छोड़ छाड़ के सारे छप्पर खोल दे पर खोल दे पर खोल दे पर खोल दे पर बंद घड़ी की भी रुकी हुई सुई होती सही दो दफा चुप क्यों है रहना मन का तू कहना रोके चाहे हिचकियां खोल पर खोल पर खोल पर
So once more, good evening, friends, and welcome to all the mentors. Brain Teaser team welcomes you to this second semi-finals of this fourth season of Big Q. As you are all aware, Brain Teaser is an online platform for hosting quiz for ophthalmologists of our country since last 6 years, and it has been since last 3 years we are being doing an exclusive postgraduate quiz with the aim of getting all the postgraduates on a single platform. We are sincerely thankful to the Ophthalmological Society of Nagpur, which has agreed to be a part of our this particular venture. In this fourth season, we had 6 preliminary rounds, 4 quarterfinals, 2 semifinals, and there would be one final on the following Wednesdays, which are being aired on every Wednesday at around 7:30 p.m. Brain Teaser team is extremely thankful to the team of quiz masters who have toiled hard to create such a wonderful experience of learning with fun. Today's episode, we have new other quiz masters, new quiz masters. We welcome Dr. Jaspreet Sukija, who is currently working as a professor in pediatric ophthalmology, strabismus and neuro-ophthalmology division at Advanced Eye Center, PGI, Chandigarh. And the second quiz master for today is Dr. Santosh Shunawar, who is currently head of the Department of Ophthalmic Plastic Surgery and Ocular Oncology at the Center of Sight, Hyderabad. And our third quiz master is going to be another other than our own co-host, my own co-host, Dr. Shilpi Narnavre, who is a vitreoretinal surgeon at Sarakshi Netralaya. Well, everyone is aware, money maketh a mayor go, which is an old saying, and such mega projects is not possible without a strong financial support from industry. His Highness has been our partner for this particular season, and my sincere most gratitude to Mr. Suryanarayan and Mr. Naresh, Mr. Kaustubh for their support and pushing us to start this season. I would definitely fail in my duties if I don't acknowledge the field force of His Highness, who made so much of an efforts to enroll the PGs from across the country. Well, smooth and flawless execution of Brain Teaser platform, the person behind it and the team, Neurotech, Mr. Sai and his team, we are extremely thankful for carrying through us through this season as flawlessly as it has been for last 6 seasons. So now without much ado, can I request my co-host, Dr. Shilpi, to carry forward the proceedings and familiarize all our participants with the rule of the game.
Sure. So, welcome, friends. Welcome to the semi-final 2. So, in this season, this is the second semi-final. In semi-final, for semi-finals, we selected 20 teams, 10 teams per semi-final. And today is the second semi-final. So, the finals will be on the subsequent Wednesday, that is on 25th of June at the same time, that is 7:30 p.m. So for teams, you have to log in through two devices, that is Kahoot and the Zoom platform. First is a live quizzing on the Zoom platform. It will be face to face with the teams only, while the second screen is the Kahoot platform for MCQ round, and it is to be played by both the audience and the teams. I request all the mentors to log in from separate screen only on the Zoom platform. So 5 out of 10 teams from today's semi-final, they will qualify for the finals. And what is the criteria? It is the respective marks of your semi-finals round, that is today's round. Teams who are not playing today's semi-final, they can play as an audience in a private practitioner category. So in today's semi-final, we have MCQ round for both the teams and the audience. So there will be 3 sets of MCQs. Each set will have 5 questions. You will get 10 seconds per question to answer. There is no negative marking in this round. The second is the case-based round. It is only for the teams. In this round, you will have to answer 3 questions in 30 seconds time. Remember, there is negative marking in this. So for every correct response, you will get plus 10. For incorrect answer, you will get minus 5. But if you don't answer or say pass, there will be no marks either deducted or credited to your account. So in this, in 30 seconds time, you have to answer 3 questions. So if you don't know the answer, just say pass. And if time is remaining, you can go back and answer the previous question. Similarly, the third round is the rapid fire round that is also only for the teams. In this rapid fire round, you will have to answer 5 questions in 30 seconds time. Again, plus 10 for the correct response, minus 5 for the incorrect answer, and there is no marks if you don't answer or say pass. So these are the prizes for the finals for the postgraduates, while for our audience, these prizes are per episode. So without wasting much time, let's start with our first MCQ set. So the first question is, which of the following is a false statement about diabetic maculopathy? Your options are option A, OCTA, OCTA. It can identify areas of retinal capillary non-perfusion. Option B, it is useful in identifying leaking microaneurysms before planning focal laser treatment. Option C, OCTA can distinguish between NVE and IRMAs. And option D, OCTA may be able to estimate the activity of status of the neovascularization. Your time starts now. Time is up and let's see what is the correct answer. The correct answer is option B. So OCTA is capable of delineating the retinal capillary non-perfusion with good resolution. It is unable to evaluate the breakdown of the blood-retinal barrier. Since it can provide the information of various layers, so it also helps in distinguishing between the retinal neovascularization, which develops anterior to the retinal vessels and above the internal limiting membrane. While the IRMAs, that is intraretinal microvascular abnormalities, they occur in the same plane as the retinal blood vessels. So you can easily differentiate between the NVE and the IRMAs on OCTA. And also there is absence of the leakage blood, which is seen in FFA, but it allows OCTA to generate the higher quality images of microvascular structures, even when the vessel wall is leaky. So if there is exuberant vascular proliferation, it can be picked up on the OCTA and is considered as a sign of active neovascularization. Now coming to the second question, what is the most likely diagnosis with the image shown here? Option A, is it right Duane syndrome? Option B, bilateral Duane syndrome. Option C, right sixth nerve palsy. Or option D, is it bilateral sixth nerve palsy? And your time starts now. Time is up and let's see what is the correct answer. The correct answer is bilateral Duane syndrome. So it is bilateral type 1 Duane syndrome. You can see that there is esotropy on the primary gaze. severe limitation of abduction, and globe retraction on adduction. Moving on to the next question, which is a false statement regarding protein and protein breakdown in the lens? Option A, protein accounts for 33% of the lens weight. Option B, active proteolysis occurs throughout the lens. Option C, crystallins account for 90% of the lens proteins. And option D, calpain 2 degrades alpha and beta crystallins. And your time starts now. Time is up. And the correct answer is option B. Active proteolysis occurs throughout the lens. This is a false statement. Protein synthesis occurs only in the peripheral lens cells. Proteins in the lens fiber cells, they must therefore survive many decades if enzymatic functions and the integrity of the gap junctions are to be preserved. Active proteolysis, though it's not a feature of the lens fiber cells, but it sometimes occurs in the peripheral cells. Moving on to the fourth question, which of the following diseases will exhibit these electrophysiological patterns? Read this chart and see the options. Which diseases will exhibit these electrophysiological patterns? Your options are option A, retinitis pigmentosa, option B, Best disease, option C, cancer-associated retinopathy, and option D, Cone rod dystrophy. And your time starts now. Time is up. And the correct answer is option B, that is Best disease. Why? Because in Best disease, ERG is normal and EOG is abnormal. And the picture above shown has the normal ERG. Moving on to the last question of this set. A 70-year-old one-eyed gentleman has these findings in his only seeing eye. So which of the following is most appropriate in this case? Option A, intravitreal aflibercept. Option B, intravitreal faricimab. Option C, low vision aid trials. And option D, photodynamic therapy with verteporfin. And your time starts now. Time is up. And the correct answer is option C, that is low vision aid trial. Because this is a case, this picture shows the end stage of neovascular, that is wet AMD, that is scarring of the macula. So in such cases, there is no role of any intravitreal injections, anti-VEGFs, or the PDT. So with this, we end with the first round of MCQs. And now it's my privilege to introduce our first quiz master for today, that is Dr. Jaspreet Sukija sir. He is a professor in pediatric ophthalmology at Advanced Center Chandigarh. He is trained at Great Ormond Street Hospital, Moorfields Eye Hospital, King's College Hospital, National Institute of Neurology and Neurosurgery, London. He is the past president of Chandigarh Ophthalmological Society, Joint Secretary of Strabismus and Pediatric Ophthalmic Society of India, ex-Joint Secretary of North Zone Ophthalmological Society, ex-member of Managing Committee AIOS and Chandigarh Ophthalmological Society. He has more than 150 publications to his credit, which with H index of 20. And he has also contributed to many chapters in the books. He has been awarded and honored with the Associate Editor of Acta Ophthalmologica in the Cataract section, Section Editor of Strabismus in IGO. He has delivered Vidarbh Ophthalmologic Society Oration in 2024, Excellence in Strabismology Award by SPOSI, AIOS International Ophthalmic Heroes Award in 2021 and 22. He is the runner-up at Annual Conference of British Isles Pediatric Ophthalmology and Strabismus Society 2021. Orbis International Gold Medal at European Society of Cataract and Refractive Surgery, and also the Best Video Award at the same conference. He has been also awarded with the Om Prakash Award in Pediatric Ophthalmology by AIOS in 2020, Dr. Prem Chandra Award by North Zone Ophthalmological Society, Professor Hanumanta Reddy Award and Gold Medal by IRISI. He is an invited faculty and speaker at various international and national pediatric ophthalmology and strabismus conferences. And he is also reviewer of many international journals and evaluator of instruction courses, papers, and videos. So with this, I hand over the screen to Dr. Jaspreet sir.
Thank you, Dr. Shilpi, for that kind introduction. I mean, it's such a lengthy one. I was not aware that you'll be speaking all these things. Thank you so much. So, for the residents now, we can go on to the case-based scenarios. I mean, they're not that difficult, and just have to apply your mind and just probably you'll be getting through them. So, can we have the first question?
Yes, sir. So we'll first invite the first team. The
Okay.
first team is Team 7 Pupil Petrol. Team 7. Please unmute.
Hello.
Yeah.
Hello.
And please.
One
Hello.
second.
Yes.
Yes. So, yeah, I
Please
can see
introduce
that.
yourself, so that we can make sure that you are audible also.
Hi, I'm Dr. Reshma. I'm finally a resident in St. John's Medical College, Bangalore.
I'm Dr. Darren from St. John's Medical College, final year.
So shall we
Yeah.
start?
Yeah, we can go on to the first question.
Yes, sir.
Yeah. So basically, just have a look at these two images. The first one is the anterior segment, and then you have this image as well. So basically, what happens is this is a child, 10-year-old, who presented with decrease in vision in his right eye for 1 month, following some particle going into his eyes. His orbital imaging is as shown here. So can you have the questions? So what is your diagnosis?
Heterosis bulbi.
Second. What is the investigation of choice?
CT orbits.
And what would be the finding on histopathology of the lesion, and which special stain should be used?
Pass.
Okay. So can we have the answers?
Yes.
So you're right. I mean, because you can see these golden brown pigments on the anterior lens capsule. You can see a hole in the iris. So probably this is all hemosiderin deposits because of the iron. It's a siderotic cataract. You're very right. The investigation of choice, no doubt, is the CT scan. You can see a bright object
Yes.
here, which is the foreign body. So in children, ultrasound can also be done, but then the child moves his eyes a lot. So sometimes it's difficult. I mean, you might miss that small foreign
Yes.
body which is there. So CT scan is no doubt the investigation of choice in these cases. What we be finding on histopathology? Well, it's a coarse golden brown hemosiderin pigment, and you use special stains for this, like pearl stains and the Prussian blue. Now, this foreign bodies is most commonly seen with the iron foreign bodies, but it can occur even without that. Sometimes there's just a clotted blood which is there, which releases the iron, and that can also
Yes.
cause the sidrosis. You can have heterochromia here. It's a mid-dilated pupil. You can have secondary glaucoma. And the other thing is, when we did the surgery here in this patient, what we found was sclerosed vessels here. So retinal degeneration, sclerosed vessels, optic atrophy, those are some of the things which can happen. And obviously, the earlier you remove it, the better it is, because you have to have a high index of suspicion in children. In adults, fine, they come up with all those history, but in children, really, you need something like a good imaging to go on and see what it is, because the prognosis and the time, the duration is very important in these cases, because if you leave it for some time, probably the retinal degeneration starts, the optic atrophy sets in, and that then obviously leads to a, you can say, a poor visual prognosis.
Thank you, sir.
Thank you, sir.
So
So we have
plus 22 from this round. All the best for the next rounds. So the next team is Team 10. Venetia Shreya.
Hello, ma'am. Good
Hello.
evening, sir, ma'am.
Good evening.
Are we audible?
Yes,
Can
you
you
are
please?
audible. Please introduce yourself.
Yeah.
I'm Dr. Shreya. And I'm Dr. Vinisha. We are from third year residents from Sarojini Devi Eye Hospital, Hyderabad.
Okay. So welcome to the quiz, and hopefully, I think it should not be that difficult a question. So can we have the question, please?
Yes.
Yeah. So if you see this image here, is a 45-year female with progressive inward deviation with limitation of movement in any other gaze. So these are fixed eyes here. The axial length of both the eyes is 30 millimeters. So just have a look at the image and the question what is asked. So the statement which is there. So can we have the first question?
Yes.
So what is your diagnosis?
Strabismus fixus.
Okay, that's right. What are the typical MRI
The
findings?
displacement of the lateral rectus and superior rectus muscle, inferiorly and superior.
Okay. And what is your surgical plan in these cases?
Myopexy. The
I want
pass.
details. Okay. Yes. Can we have the answers, please?
Yes.
Yeah. So I think the residents, I mean, they know how to diagnose it. Was obviously when you go to the surgical plan, it's a little difficult, like in the previous team that I answered as well. So yes, it's a myopic strabismus fixus or the heavy eye syndrome. And you're right. What really happens is it's usually happens in these long eyes, in myopic eyes. So there is a staphylomenon in the superior temporal quadrant, which happens between the superior rectus and the lateral rectus. So that is why there is a nasalization of the superior rectus. So the superior rectus is shifted nasally and the lateral rectus is shifted down. So in that area, the wide gap, there is a staphyloma. So the main surgical plan is to compress this staphyloma. So how can you compress this? It's of course do a myopexy, but then you have to be specific in which what muscles. I mean, so if it's the superior and lateral rectus, that has to be done between these two muscles, obviously. But the first thing always check is do a force duction test for the medial rectus. Now, in this case, the medial rectus was tight. You have to recess that muscle first. That is, otherwise, your myopexy is not really going to work because it's a tight medial rectus. So you have to recess the medial rectus, release the force duction test, and then do a myopexy between the superior rectus and the lateral rectus so that the staphloma goes in. And that's how we did for both the eyes. And that's basically the ideal treatment for such cases.
So, sir, do we give +5 for the last?
Yes, myopexy, yes, you can do it. 10 marks for each part, isn't it?
Achha, 10 for each? Okay,
No,
sir.
no, it's 10 for each, isn't it? So we can
Yes, sir.
give 5 for the part 3.
Okay, sir. So it's 20 plus 25 for you.
That's right.
Thank you, sir.
The next team is Team 2. Team Vinny. Please introduce yourself.
Good evening, ma'am. Myself,
Good
Dr. Sinha from PMCH Patna.
Good morning, everyone. I'm Dr. Vidyanidhi from PMCH Patna.
Please be closer to the mic.
Are we audible, ma'am?
Yes.
Okay. Welcome to this quiz. And yes, so that's where we go now. This is a 9-month male child who presented with the ophthalmos in this right eye and a white reflex if you see in both the eyes with frontal bossing, low set ears, there was muscle wasting, there was hydrocephalus, and when we did an ultrasound of the posterior segment, it was normal because obviously we can't see because of the white reflex. Milestones were delayed, and there was a typical finding on the fetal MRI which was suggestive of lissencephaly. So if you just read the statement again, just make a mental picture, the summary of what are the significant findings in this statement. And then we can go on to the question. Okay, now can we have the first question? So what is your diagnosis?
The pass.
Okay. Which gene is commonly implicated?
The pass.
What is the prognosis?
The prognosis is poor. Diagnosis is Down syndrome. First answer.
Okay. Yeah, can we have the answers?
Yes.
Okay. So this is something what is known as the Walker-Warburg syndrome. So this presents with, this is typical of Lissencephaly is typical of Walker-Warburg syndrome when you do a fetal MRI. And these are the other features. When you have a cataract in both the eyes, you have frontal bossing, you have low set ears. It is basically what happens, it's a type of a muscle dystrophy which affects the brain and the eye as well. And you can see which gene is implicated. Obviously, this is the menocyl transferase gene here, which is implicated, which leads to underdevelopment of tissues in the muscles, the brain, as well as the eye. And because of this, most of the children, they die by 3 years. So the prognosis is quite dismal in these cases. So those are rare things. We do get these cases. And of course, it's a holistic approach which one has to follow, just not just see the eyes and the cataract. Can we have the next
So,
team
sir,
now?
first they said pass.
Okay. No, they couldn't get it. The prognosis they say was not good, so that I'll agree. So give them 5 marks for the part 3.
So +5 for you.
Yes.
So let's move on to the next team. Next team is Team 5. Team 5
Yes, ma'am.
TZ. Yes.
Good morning, sir. Good evening, sir. I'm Dr. Lokesh from RKDF Medical College, Bhopal. My co-member is Dr. Vartika from same medical college.
Please switch on your video.
Yes, ma'am.
Where is your
Ma'am, my partner is not currently present here because I'm in the DRP, so we are logging from the 2 different devices.
Where is she? Has she logged in?
Yes, ma'am, she's logged in.
Ask her to please.
Okay.
Meanwhile, can we move on to the next team?
Yes.
Okay. So the next team is Team 8, the iconic team. We can't hear you.
Hello. Are we audible now?
No. Please
No.
raise.
We can't hear you.
Hello, are we audible now?
Yes.
Good evening. I'm Dr. Ahmad Khwaja, third year resident from GMC Aurangabad.
I am Dr. Vaishnavi Deshmukh, third year resident from GMC Aurangabad.
Welcome.
Are you
So
ready?
can we have?
Yes.
Yeah. So this is the fundus photograph. So a 35-year female who presented this way. She had progressive decrease in vision since 10 months, and she was diagnosed with optic nerve meningioma. So obviously there are a lot of differential diagnoses in a 35-year-old presenting with progressive loss of vision. But yes, the diagnosis was there, an optic nerve meningioma. So you have a diagnosis in a 35-year-old female. Let's have the first question, please. What are the 3 findings on the optic disc? Any 3 findings?
There is blurring of the disc margin.
Dispaler.
Okay.
Dispaler.
Blurring of disc margins and optociliary shunt vessels.
Okay. Next question. What is the systemic association of this tumor?
Pass.
Next. What is the typical sign of meningioma in MRI? Time's up.
Okay.
Tram track sign.
Yeah, so the three findings of the on the optic disc are it's a pale disc edema. So it's edema as well as pallor. So it's pale disc edema. The second is if you see there is sheathing of the vessels. And third is you are right, there is an optociliary shunt vessel. So this is the shunt vessels. What is happening? So there is shunting of blood because of compression of the venous circulation in the optic nerve. What is the systemic association of this tumor? It is neurofibromatosis type 2. And what is the typical sign? You're right, it's the Tram-Tack sign or the donut sign. So these are typical things when you can diagnose a meningioma with. Yes, now the marks, please.
So plus 20
Yes, so they got that right. They got
for the
20.
first and the
Last
third.
question.
Okay.
Thank you.
Yes, sir. Thank you, sir.
Okay, welcome. So team 5, are you ready?
Ma'am, she is currently just logging. Can you move into the other team?
Other teams. Okay.
Yes.
So next team is team 1, oculus curatio.
Yeah. So welcome to the quiz.
Sir, I'm Dr. Saurabh from MM Joshi Institute.
I'm Dr. Uttara Bhatt from MM Joshi Institute. We are both second year PG residents.
Okay, good. Second years. So let's see what you have for your question. Yeah. So we have two images here. This is the intro image. So a 10-year boy presented with gradually deteriorating vision in the left eye. He had undergone past planar vitrectomy for endophthalmitis following scleral fixated intraocular lens implantation. So this child has a scleral fixated intraocular lens, and you can see the intraoperative finding. You have something along here and something here. So can we have the questions, please?
Yes.
So what is the cause of low vision in this image? See the anterior segment, what's happening?
Corneal edema.
Next. Which investigations are shown here? This investigation and this, what are they?
UBM. UBM.
And?
UBM, sir.
This. So what are the arrows highlighting? Okay, fine. What are the arrows highlighting in the lower image which could help guide surgery? These arrows, what are they highlighting?
Intraocular SF5. No, sir, pass.
Okay.
Pass,
So can
sir.
you give the answers, please? Yeah. So the cause of low vision is just a visual axis obscuration here, which is caused by the membrane. If you see this dense opacification. So it's a membrane on the eye well. Okay. So because you can't really see the eye well reflex, so it's not posterior, it's on the eye well. Now, which investigations are shown here? You are right, this is UBM, but this is an intraoperative OCT. What is showing? It's a dense membrane with a light reflex of the IOL, which is not really seen, but it's clear on the UBM. So see this membrane here and see this reflex of the IOL here. So the membrane is above the IOL, and the important thing is what they are highlighting is there is a gap between the membrane and the IOL. So it's not sticking to the IOL. So that is why your surgery, that's helps in surgical planning. Because if it's sticking, then you know that the IOL can be compromised. But it's not sticking, you can just simply go in with an MVR and just give a nick here and remove with the cutter. So that's the importance of doing imaging in these cases. The marks, please.
Thank you, sir.
-5 for the plus for the first question, +5 for the second question, and 0 for the last question. So it totals to 0. So the next team is
So
team
this one.
4. Team 4, Oculus experts.
Hello, good evening. I am Dr. Ahan from JIPMER and
I am Pooja from JIPMER. We are third year residents.
Connection.
Sir, you are muted. Just wait, sir.
There was something wrong with the internet connection. Yeah. So what I heard was they are from JIPMA?
Yes, sir.
Yes,
Third
sir.
year.
Okay, all the best. So
Thank
we
you,
have a 14-year male with this picture since infancy. With there is some abnormality of the left eye superior oblique on imaging. So can we have the questions, please? So what is your diagnosis? Just
Brown
give.
syndrome. No.
Okay. What alphabetical pattern of strabismus do you expect between the up gaze and the down gaze?
We'll expect A pattern.
Okay. Third, what is the aim of different surgical procedures performed for this condition?
To compensate for abnormal head posture or primary gaze deviation.
Thank you. Can we have the answers, please?
Yes, sir.
So yes, your diagnosis is right. It's a Brown syndrome, but it's a congenital Brown syndrome because I said what is happening is since infancy. What alphabetical pattern? Yes, many of you would get it wrong because you think it's superior oblique is overacting and it's an A pattern. It's not actually. It's a V pattern because there is what happens is there is some force being applied when the child wants to look up. So it just plays outside. So it's kind of a V pattern which happens. And the aim of surgical procedure is agreed. What all those are just signs which you decrease. But this what is the aim of the actual surgical procedure is basically to lengthen the muscle. So by lengthening the muscle, you can the abnormal head posture would go away. If there's a primary position hypertropia, that would go away. So basically, the main crux is to lengthen the muscle in these cases. Yes.
So plus
So
10
they
for
could get absolutely
plus
just
10 for first, minus 5 for second. What about the third one, sir?
third one. Give them a 0 for that. Doesn't matter. I mean,
Okay. No
they
negative.
were
Yeah.
trying to get what comes. No negative marking for that.
Okay.
Yeah.
Plus 5 from this round. So the next team is team 5.
Yes, ma'am. Yes, ma'am.
Yes, ma'am.
Please introduce yourself.
Yes, ma'am.
I'm Dr. Lokesh from Medical College, and Dr. Vartika from RKDF Medical College as well. She's by the name Golden Gazes.
Hello.
Who is going to ask, sir?
Ma'am, I'm going to answer.
Okay. Okay. So
yeah, welcome. So next case is you have a 30-year-old male who presents with diplopia following functional endoscopic sinus surgery. So if you can see here, the patient is looking to the right. This is the primary gaze, and here the patient is looking towards the left. So this is some of the you can see the gaze pictures what you see, and you have to decipher why the patient is having diplopia in these questions. So I'll just start off with the first question. Can we have the first question?
Yes.
Yeah. What is the probable cause of diplopia here?
Sir, overactivity of the lateral rectus muscle.
Which eye?
Overactivity of the lateral rectus of the right.
Okay, next question. What is the investigation of choice? Time is running out so fast. Next question, please. What is the most effective surgical treatment for this?
Recession of the medial recession of the lateral rectus muscle.
Okay. Can we have the answers, please? So the most common, or you can say the cause of diplopia is the medial axis transaction of the right eye. So what happens here? What is happening here? Here you can see there is abduction here, adduction in this eye. Primary gaze, there is exotropia of the right eye. Now, what is happening when the patient is looking towards the left? This eye is not moving. So with the functional endoscopic sinus surgery, they have transected the medial rectus. So that is the cause of diplopia in this patient. And what is the investigation of choice? Because it's a soft tissue, you have to do an MRI in these cases to know the point of transaction, whether it's anterior or posterior. And what is the most effective surgical treatment? Well, if on MRI you get an anterior point, you can just bring the muscle forward, tie it up. But in most of the cases, you are unable to trace the medial rectus. And then what you have to do is transpose the vertical rectus, the superior and the inferior rectus to the medial side. And that is how you can get a primary position orthotropia and some movements to the other side. So that is, you have these cases, you do get these cases from ENT, and you have to actually know that it's not just a palsy or something. It's an uncommon thing because it's the third nerve which is supplying. So you would have other muscles which are there. So it's a transected muscle, the medial rectus, caused by the endoscopic sinus surgery.
So, sir, what about the marks?
Not really. I mean, that was first was wrong and the third was also wrong. Second, probably they had a
Okay.
pass. Yeah,
Pass. Yes. So it's -10 from this round.
true.
The next team is Team 9. Team 9 Ninjas.
Good evening, ma'am.
Good evening.
Ma'am, I'm Chandravardhan and he's Saitija. We are from Arvind Hospital, Coimbatore.
Coimbatore, ma'am.
Okay. Which year students?
Second year, ma'am.
Second.
Good. Welcome. So let's have the question.
Yes.
So 12-year female with drooping of the left eye since 1 month. So if you see these images here, there is a little ptosis here, something what we did here. And then you have one image here. So can we have the questions, please?
Yes.
So what is the test being performed?
I expect this.
What is your diagnosis in this?
Myasthenia gravis.
Okay. Name another sensitive test for this condition.
Antibody. Repeat RNS test or antibody testing. Repetitive nerve stimulation.
In the clinic. Not
Antibody. Still antibody.
Fatigability tester.
What fatigability?
Eyelid fatigability testing.
Okay, can we have the question answers, please?
Yes.
So it was not that difficult a question, I think. Yeah. So okay, fine. The eye spec test, but that's being shown here, fine. Obviously, it's done for myasthenia gravis, but the other sensitive test, which is about 80 to 90% sensitive, is the Kogan lid twitch sign, not any fatigability. Okay. And I have not asked for any investigation, which is RNFL, which you are saying. Obviously, that's quite a sensitive test investigation there. So this is the thing in the clinic what you can do: an eye spec and a Kogan lid twitch sign. This is the most sensitive test to diagnose myasthenia gravis.
Yes, sir.
Yeah.
So it's +15 to them, +10 for first, +10 for second, and -5 for the last.
Yes, you're right.
So the next team is Team 3, eye catchers.
Good evening.
Good evening, ma'am. Good evening, sir. We are from Yanapoya Medical College, final years. I'm Dr. Aishwarya.
I'm Dr. Saif.
Welcome.
Please
So can
be
we have
closer to the mic. Yes.
Yeah. Can you have the question, please?
Yes, sir.
So we have a 15-year male who presented with chronic redness, irritation, and pain in both the eyes. The photograph of the left eye is shown here. So this is when you have the everted upper lid, and this is the anterior segment picture of the same eye. So can we have the questions, please? Yeah. So what is your complete diagnosis based on both images?
Mixed VKC.
BKC with corneal ulcer, shield ulcer.
Mixed VKC.
Next question, please.
What is the first line management?
So first line management will be
Time is running out fast.
no. The low antihistamines and the steroids, topical steroids.
So what drug is used?
Tacrolimus.
Anything else? Okay, fine. So the last question was answered when your time was up. Can we have the answers? Okay, fine. They did answer. It is severe PKC with a shield ulcer, which is seen here. What is the first line management? Topical antihistamines, corticosteroids, lubricants. And what drug is used in recalcitrant cases? You can have cyclosporin or you can have tacrolimus as well. So I don't know how to now.
We can give them.
Okay, fine.
Yeah. The first team to score plus 30.
Yeah.
So good. The last team is team 6.
Thank you, sir. Thank you.
Team 6.
Good evening. Am I visible, audible?
Yes, yes.
I'm Dr. Samyak. I'm from KMC Manipal.
I'm Dr. Anjana, final year KMC Manipal.
Welcome.
So are you ready?
Yes.
Okay. So look at the images. 35-year female with blurring of vision in the left eye since 1 year. So these are undilated photographs. We haven't put any mydriatics in these. So what really happening to the pupil size is, if you see, when the normal room light, the right is 3.5 millimeters and the left is 5 millimeters. You can see the difference. So when you switch off the light, this dilates to 5 millimeters. This stays 5 millimeters. When you switch on the lights, I mean, when you put torch light, the pupil constricts to 2.5 millimeters, but this doesn't really constrict to 5 millimeters. So can we have the questions, please?
Yes, sir.
What is the cause of blurred vision in this case?
Dilated
Loss of accommodation.
loss of accommodation. IDs.
Say that again.
IDs people.
Okay, what is the treatment for it?
Pilocarpine low dose.
You have to specify the dose. What is low dose?
0.2%.
Thank you. Okay, more or less. Yes. So the cause of blurred vision in these cases is a mid-dilated pupil. What happens is the accommodation usually does not go away because you have a lot of accommodating fibers here. So it is just the blurring of the distance vision which really happens. Because of that, most of them really don't need glasses for near. And what is your diagnosis? Well, it's the adiastonic pupil, which you were right. And what is the treatment? Well, of course, pilocarpine, low dose, that is 0.125% or just observation. It's not 0.2%, it's 0.125%. So
Marks.
you can give them. So can we have, yeah.
For the first, they answered. I couldn't hear the answer basically.
So we can give them 5 for first. The second is in these cases.
So
it's just a
for first, it is plus 5.
Yes.
Second is plus 10.
Third is plus 5.
Plus 5. Okay. So plus 20. Okay.
Yeah.
Thank you.
Thank you.
So with this, we end with the case-based round. Jasprit sir, just a request. Santosh sir is busy in one of the other meetings. So will it be possible for you to take his rapid fire round after this MCQ round? I will be displaying the question.
No, that's okay, but I was supposed to just leave.
Okay.
I mean, I
Okay.
took not here, but I was just had a plan to engagement somewhere else actually.
Okay. Okay. Not an issue, sir. I'll carry forward. Yeah. Thank you, sir.
Thank you so much. Thank you.
So, so yes, refresh your Kahoot buttons and everything. So it's time for the second set of MCQs. So the first question in this round is 80-year-old lady with temporal headache and sudden unilateral loss of vision. Which is the most appropriate next step in the management? Option A, MRI brain with orbit. Option B, FFA. Option C, systemic steroids. And option D, peripheral smear. Your time starts now. Time is up. And the correct answer is systemic steroids. So this is a case of giant cell arthritis, that is arthritic AION. And in such cases, the immediate course of action is start with the steroids. Later on, we do the ESR and CRP and the temporal artery Doppler or the biopsy to confirm the diagnosis. So the next question is, which of the following is an appropriate IOL power calculation formula? Option A, it's Barrett Universal 2. Or option B, Hofer Q. Option C, both of them are used as an appropriate IOL power calculation formula. And option D is none of the above. Your time starts now. So let's see what is the answer. The answer is C. So both of these are used as an appropriate formulas for calculating the IL power. So if we see here that the Holiday 1, Hofer Q and Holiday 2, these and the Barrett's, they are used for the calculating the IL powers nowadays. So now coming to the next question, a 48-year-old lady presents with painless loss of vision in the right eye over a period of 1 year. Her BCVA is in the right eye, it's no PL, while in the left eye, it is 6/6. Visual fields were normal in the left eye. So what is the probable diagnosis? Here the fundus photos are on the left side, you can see the left eye, and then the right side is the OD. So the option A is it old central retinal vein occlusion? B, diabetic papillophlebitis. C, optic nerve sheath meningioma. Or option D, old ophthalmic artery occlusion. Your time starts now. So time is up. And the correct answer is option C, that is optic nerve sheath meningioma. So this is a case, it's a benign tumor and you get tram track calcification on the CT scan and the hematurosis is gaze evoked and optociliary shunt vessels, they occurs due to ischemia. In this case, it is not old central retinal vein because it is progressive over a period of 1 year. Diabetic papillophlebitis doesn't looks like this. Old ophthalmic artery occlusion, you will get some signs of ischemia or the sclerosed blood vessels on the fundus. So now moving on to the next question. What is the most likely diagnosis? Just look at the arrow and what can be the most likely diagnosis. Option A, dislocated IOL. Option B, vitreous hemorrhage. Option C, dislocated crystalline lens, or is it option D, that is intraocular foreign body? Your time starts now. So the correct answer is option D, intraocular foreign body. So typically the foreign body, the retained intraocular foreign bodies, they have a characteristic appearance of comet tail artifacts. And these are caused by the multiple internal reflections within a small highly reflective object. So the last MCQ of this set is, what is the correct spectacle prescription for this at a working distance of 1 meter? Options are option A, +1 diopter spherical with -2 diopter cylinder at 180 degrees. Or B, +2 diopter spherical with -1 cylinder at 90 degrees. Option C, -1 spherical with +2 cylinder at 90 degrees. Option D, none of the above. Your time starts now. Time is up. And the correct answer is none of the above. So For this, we can have two answers. Either it is +1 diopter with -2 cylinder at 90 degrees, or -1 sphere with +2 cylinder at 180 degrees. So with this, we end with case-based round also and 2 sets of MCQs. It's time for a commercial break, and we are highly indebted to His Highness team for all the financial support. So with this, I introduce our next quiz master, Dr. Santosh Hanavasa. He is presently the secretary of AIOS, and he currently heads the Department of Ophthalmic Plastic Surgery and Ocular Oncology at the Center of Sight, Hyderabad. He is very popular for his program, that is iFocus PG Education Program, with over 2 million views. He was the editor of Indian Journal of Ophthalmology and is responsible for soaring its impact factor from 0.83 to 3.1. He's currently the Honorary General Secretary of All India Ophthalmological Society, with ocular oncology as his research focus and over 400 index publications. He tops the Stanford list of researchers of the highest impact in India. He has won many awards and has many credits to his CV. So as sir is not available for a while, so I'll take over on his behalf. So the team 1 is team 2. Team 2. Yes.
Yes, ma'am.
Yes. So please be closer to the mic. Are you ready?
Yes, ma'am.
So one by one question will come. I'll not read the question. You'll have to just see the question. If you know the answer, you say the answer, else you say pass. Okay? So your time starts now.
Pass. 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 Pass.
Pass. Okay. Time is up. So let's see what are the answers. So with severe ocular surface disease presence with cicatrizing conjunctivitis, symblepharon and autoantibodies against BP180 and BP230 is mucous membrane pemphigoid. The landmark study which demonstrated the benefit of IOP lowering in normal tension glaucoma is collaborative normal tension glaucoma study. And which childhood orbital malignancy involves PAX3 FOX01 fusion and rapidly progressive proptosis is alveolar rhabdomyosarcoma. The uveitic condition which causes exudative detachments, disc edema, and sunset glow fundus is classical of VKH. And peripheral retinal neovascularization, it presents as CFAN in cases of sickle cell disease. So you say pass through all the questions. So 0 from this round. Next team is team 8, the iconic T team.
Yes,
Team
ma'am.
8?
Yes, ma'am.
Yes. So are you ready?
Yes.
Yes, ma'am.
So your time starts.
Also by current and testing.
Pass. Pass.
Brimonidine.
Brimonidine system. Pass.
Arcetation.
Pass.
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 Pass. Fourth is basal cell carcinoma.
The time is up. Let's see what are the answers. So which dystrophy causes recurrent erosions and lattice lines on confocal microscopy is lattice corneal dystrophy. And the IOL master biometry, it works on the principle of optical low coherence interferometry. The RCT, which showed the neuroprotective efficacy of brimonidine versus timolol, is low pressure glaucoma treatment study. The eyelid malignancy, which shows pegatoid spread and mimics blepharitis, is sebaceous gland carcinoma. And the chorioretinal congenital infection is cytomegalovirus. So you also passed all the questions. So it is 0 from this round.
Yes, ma'am.
So the next team is team 5.
Yes, ma'am.
So are you ready?
Yes, ma'am.
Okay. So your time starts now.
Pass. 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 Pass.
Okay. You also passed all the questions. So let's see what are the answers. So it's Terence marginal degeneration, which presents as the peripheral corneal thinning and lipid deposition with intact epithelium. The procedure which uses intraoperative aberrometry for IOL power adjustment is ORA system. The third one, you should always know, it's a very common question which is asked. So the study which focused on diabetic retinopathy laser treatment is ETDRS study. The gland tumor which shows cribriform histology is adenoid cystic carcinoma, while in tuberous sclerosis, one gets the facial angiofibromas and retinal astrocytomas. So moving on to the next team. Next team is team 8, Eye Ninjas.
Yes, ma'am.
Yes, ma'am.
Okay. So are you ready?
Yes,
ma'am.
Okay. All the best.
Thank you.
Your time starts now.
Pass. 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 Second one is eye trace, ma'am.
Second one is?
Eye trace.
OHTS, third one.
Okay.
Fourth pass.
Coats.
Coats disease.
Okay. So let's see what are the answers. The first one is Reproxalap. It is a recent molecule which targets the IL-1 in dry eye diseases. The refractive tool for total ocular aberrations, including higher order ones, it's called as wavefront aberrometry. Okay. And the trial, yes, you correctly answered. It is ocular hypertension treatment study. The fourth one is the Treacher's-Collins syndrome, in which it is a congenital syndrome which shows the mandibular hypoplasia and V-pattern strabismus. And yes, the retinal vasculopathy, which presents with telangiectasia, aneurysms, and exudation in children, is the Coats disease. So you get plus 10 for the third one, plus 10 for the fifth one. Second one, I'll not because we needed this answer. So, okay, I'll not even deduct or give you any marks. So it is plus 20 for you.
Thank you.
Thank you.
Because we needed the method basically.
Yeah.
Next team is team 3, eye catchers.
Yes, ma'am.
Are you ready?
Yes, ma'am.
Okay. So shall I start?
Yes, ma'am.
Be closer to the mic, please. So your time starts now.
Pass. Head off lenses. Next. 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 Headlight in the toxoplasma.
So let's see what are the answers. So the first one is the Steven-Johnson or the Sjogren syndrome, in which you get the filamentary keratitis due to mucin deficiency. The IOL, which is designed to extend depth of focus using chromatic aberrations, are, yes, the EDOF lenses, you are right, it's symphony IOLs. The study is disc hemorrhage study, which used to study the optic disc hemorrhage as a marker for glaucoma progression. The triangle of Koch and its relevance is that it is the anatomical area which is relevant in the dacrocystorhinostomy or DACR study. And the disease which presents with headlight in the fog appearance is the toxoplasma chorioretinitis. So plus 20 to you.
Thank you.
Thank you.
Second one and the last one.
Yes.
So this is team 3, that is eye catchers. So moving on to the next team, team 1.
Yes, ma'am.
Are you ready?
Yes, ma'am.
Be closer to the mic. Your time starts now.
Patients, yeah. OSSN. Which one? Pass. Pass, ma'am. Pass. Then the limitation abduction and retraction. Yeah. DRS fourth. Pass. No. DRS fourth. Next.
Next time.
Pass.
Especially.
Second
Pass.
is camera inlay.
Okay. And the last one, pass.
Yeah.
Okay. So let's see what are the answers. Yes, the first one is right. The ocular surface tumor, which presents commonly in xeroderma patients, is ocular
Yes,
surface
yes.
neoplasia. Second is corneal inlay is camera inlay. The third is the study which compared the efficacy of SLT and medications in primary open angle glaucoma is light study. Syndrome, yes, if you would have attended the questions, yes, it is DRS, dual retraction syndrome. And the disease in which you can see bilateral serous retinal detachments with thickened choroid, especially in men, it is CSCR. Okay. So you have answered first, second, and fourth correct. So plus 30 to you. The next team is team 7. Team 7.
Yes, ma'am.
So are you ready?
Yes, ma'am.
Be closer to the mic. All the best. Your time starts now.
Ted. Next one.
Which technology allows mapping to see the corneal radiation?
Pentacam.
Pentacam. Which neurophthalmic condition shows sexual loss, pain, and RAPD?
Optic neuritis.
Which condition is characterized by spontaneous
Fat. Next.
Okay, time.
Orbital fat atrophy.
What?
Orbital fat atrophy.
Okay. Last you can attempt, but you will not get the marks.
Okay. Which fifth one can we answer?
Yes, you can answer, but you will not get the marks.
It's okay.
It's okay.
But you can answer.
So ERG findings will be diminished A wave.
Okay. So let's see what are the answers. So first one is a macular corneal dystrophy, which shows the honeycomb opacities in posterior stroma. Okay, with the mutation in CHST6 gene. We have asked for the technology. Okay.
Okay.
So it is simplet imaging. Third one is right, optic neuritis. Fourth one is also, okay, it's right. It's silent sinus syndrome or the senile enophthalmos. And the typical ERG finding in X-linked retinoschisis is selective reduction in the B wave amplitude. So it's plus 10 for the third, plus 10 for the fourth answer. For the second one, I'll not either deduct or give you any marks. First one is the wrong one. So it is plus 50.
Okay.
Okay. So the next team is team 6.
Yes.
Hello. Good
So are you
evening.
ready?
Yes.
Yes. All the best. Be closer to the mic. The time starts now.
Next. 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 Search Weber syndrome. Next. Marcus Gunn.
What? For the last one, you want to attempt or you want to pass?
Pass.
Okay. So let's see what are the answers. So the condition with the cherry red spot with normal intelligence is Niemann-Pick disease type B. The abrasion which that abrasion type which wavefront guided LASIK specifically aim to correct the beyond sphere and cylinder is the higher order abrasions. The study which evaluated the risk factors for progression of age-related macular degeneration is age-related eye disease study. Syndrome, yes, you correctly answered. It is Sturge-Weber syndrome. And the rare acquired syn kinesis characterized by involuntary eye closure on jaw opening, and it often develops after facial nerve palsy, is the Marin-Emmett syndrome. So you get plus 10
Thank you,
for
ma'am.
the fourth answer. Moving on to the next team. Next team in line is team 4.
Good evening, ma'am.
Good evening. Are you ready?
Yes.
Yes. So tension is building up. Okay, all the best. Your time starts now. Sorry. Okay.
Fabry's disease.
Okay.
Munderlin formula is used to calculate the ablation depth. Pass. CFEOM, congenital fibrosis, next, of extraocular muscles. Best one gene.
Okay. You want to answer the fourth one? I want specific syndrome. Or you want to pass?
Congenital monoocular elevation deficiency.
Okay.
CFUM we told before.
Okay. Let's see what's the answer. First one is correct. The Fabry's disease. It is a systemic condition causing keratopathy with whorl-like epithelial opacities and lysosomal in the lysosomal storage diseases. The second one is also correct. It is used to calculate the ablation depth in LASIK. The third one is the study which formed the basis of visual field staging in glaucoma using MD and PhD is the mean deviation and the pattern standard deviation is the advanced glaucoma intervention study. The congenital condition which causes hypotropia, chin elevation, and inability to look up is the Brown syndrome, while the gene in best vitelliform macular dystrophy is the best one gene or the VMD2 gene. So you get plus 10 for the first one, plus 2 for the second, and plus 10 for the last one. The fourth one, I wanted the name of the syndrome, so it is wrong. So it's -5, so plus 25.
Okay, ma'am. Thank you.
So last team is team 10.
Yes, ma'am.
Are you ready?
Yes, ma'am.
So all the best, team 10. Your time starts now.
Pass. Pass. Haggis. Second is Haggis. Fourth is femtosecond. Varix in 5. Varices.
You want to attempt any other question? First and third?
Second is Hages.
KOH. Third.
Okay.
Actually, pass, ma'am. Pass.
Okay, pass. So let's see what are the answers.
Nothing.
So the mucopolysaccharidosis causes corneal clouding, hepatosplenomegaly, and mental retardation is Hurler syndrome. The second one is the IL power calculation formula, which is AI based and used for post-refractive surgery eye is the Hill RBF3 or the Pearl DGS. Third one is the rapid staining technique, which highlights the fungal filaments in corneal scrapings is the KOH mount or the calcofluor white stain. The laser which is used in smile precision is the femtosecond laser, and the orbital lesions which presents with enophthalmos and which increases in proptosis during Valsalva's orbital varix. So first is correct, second is wrong, third you passed, fourth is correct, and fifth is correct. So plus 25 to you.
Ma'am, actually we said KOH, ma'am.
You said KOH?
Yes, ma'am, I did.
Okay. So it's plus 35. Sorry, I missed it. Okay. So plus
Thank you.
35. Okay. So with this, we end with the rapid fire round also. And it's time for the last set of MCQs. So refresh your Kahoot platform so that we can quickly play the MCQ set 3. So let's begin with the first question in the set 3. True statement about features of DME on FFA, which distinguishes it from Irwin gas syndrome, are all except A. Leakage is more diffuse in DME and not localized to perifoveal region. Option B. Late disc staining is seen in cases of DME and not in the IGS. Option C. Honeycomb pattern is seen in DME. And option D. Leakage is best seen in the late phases in cases of IGS. So you have to find out the false statement in this question. Your time starts now. Time is up. And the correct answer is option B. That is late staining is seen in cases of DME and not in IGS. This is a false statement. Moving on to the next question. All of the below factors increase the risk of ARMD, that is age-related macular degeneration, except option A, smoking, option B, beta blockers, option C, low levels of ocular melanin, and option D, large CD ratio. Your time starts now. Time is up. And let's see what is the correct answer. It is option D, that is large CD ratio is not a risk factor which increases the risk for the age-related macular degeneration. Third question in this set is Hudson-Staley lines in cornea are option A, they are red in color. Option B, They are yellowish red in color. Option C, yellow. Option D, yellowish brown. Your time starts now. Time is up. And the correct answer is option D. It is yellowish brown in color because of the deposition of the iron. Moving on to the second last question of this quiz is the embryonic lens is derived from option A, anterior lens epithelium, option B, pre-equatorial lens epithelium, option C, equatorial lens epithelium, and option D, posterior lens epithelium. Your time starts now. Time is up. And the correct answer is option D, that is posterior lens epithelium. So if we see, lens develops from the surface ectoderm and embryonic nucleus and the primary lens fiber cells. The posterior epithelium, it elongates to fill the lens vesicle. So embryonic nucleus, if we see, it develops from 1 to 3 months of age, while the fetal nucleus from the 3 to 9 months. The infantile nucleus 9 months till puberty, while the adult nucleus, it grows throughout the life. So the last question of today's quiz is, which of the following is least likely to be helpful for severe aqueous deficiency dry eye? Your options are option A, puntal plugs, option B, RGP lenses, option C, scleral lenses, and option D, minor salivary gland transplant. Your time starts now. Time is up. And let's see what is the correct answer. RGP lenses are least likely to be helpful in cases of severe aqueous deficiency in dry eye diseases. So if we see that RGP lenses, they will minimally help in these cases. The small diameter which sits on the cornea, so there is no water holding capacity, while the punctal plugs, they are helpful in water retention. Scleral contact lenses, they have the larger diameter, they sits on the sclera, holds the water in the cup, and there is good corneal hydration. While the minor salivary gland transplantation, though it is not done very commonly, but it can also help in relieving the corneal pathology secondary to the DED. So with this, we end the today's quiz.
Thank you, Dr. Shilpi and Dr. Jaspreet and Dr. Honavar and all the other quiz masters for contributing to this quiz. So before we sum up this particular part, we are waiting for the some summation to happen from the backend office by numeratic team. Meanwhile, let us all join us for the chat, a small chat, informal chat before we wind up the today's show. Can I request all the participants to come on the screen, get their video all on? Yeah. Shilpi, you can join. Dr. Jaspreet is still with us?
No, sir. Sir has meetings.
Okay. Okay, we have all the teams. Very curious guys. Very well played, you guys. Let's have a small chat. So let's begin with our team. Shilpi, which team we should go with? I cannot move without my co-host permission. So let me check.
Anyone you want to.
Okay, I Ninjas, come on, introduce yourself for the sake of all the viewers who have been having a look at your quiz. I Ninjas.
Good evening, sir. Good evening, everyone. I am Chandravardhan.
I'm Dr. K. Saitija. We are from Arvind Hospital, Coimbatore.
And
our mentor is DC, sir.
Dr.
Chandrasekhar,
sir.
DC, sir. So he is with us today?
Yes, sir.
Dr. DC, sir, why don't you join us?
Sir, very good evening, sir.
Good evening, sir. You are sitting on the fundus.
Yes, sir. Yes, sir.
Okay. No, because that is my domain. You are still in neuro ophthalmology.
Yeah, no, yes, sir. Yes, sir. I teach all of ophthalmology to my students, sir.
I know, I know, I know,
Yes.
I know. Just pulling you,
There is
sir. Thank you
some
for
result.
watching,
Yes. Thank you,
taking
sir.
your team again this season
Yes,
also to
yes,
the
sir.
almost semi-finals, and
Semi-finals.
let's see how much of them.
Yeah, we are proud
So
of
before
them,
we
sir.
announce, so Team Ninjas, is it how you are into second year or final year resident?
Second year.
First,
Second year.
second year resident. So how much efforts have been put by you yourself and your mentor versus? Where do you rate? And
Uh, he actually used to guide us and used to share some of these questions also. He is the main backbone for us actually in this
so
discussion.
just tell me one thing.
Yeah.
How many of this today's quiz questions means
Not directly, but
corresponded with the
something relevant
what
to that.
Dr. DC had suggested?
Something most relevant to that.
The topic might be like asked in these things, like not directly as such, but many of the things has actually been taught by DC sir, like, and
Okay,
like
very
others sir, VRE sir
So
also.
I think I will take away the credit, and if ever you make a
No, sir.
money or into
Sir, the
finance, it
credit
will
goes
go to
to them,
DC.
sir, because only when they entered the semi, I came in. Otherwise, they were junior mentors. 90% of the credit goes to them, sir.
Very good, very good. That's a typical teacher. He always gives all this credit to the success to the other students. And it's so well played, I Ninjas. Now let's move on to the next team. Before we move on to the next team, we are having this three people from private practitioners category. We have this number SJ and PAR. Why don't you join us? Just raise your hands on the chat so that our backend office team will, Mr. Sai will get you promoted as a panelist, and then we can also have a small chat with you. So just remember this three numbers: 9446430633 SJ, then 9992001508 we do not have his initials, and the third number is 9769300455, and it is per. So please raise your hands in the chat box so that we can promote you as a panelist, and then we can also have a
Sir,
small chat with you.
I've joined
Yes,
the
Sai?
PP 99200. I was actually quiz. I've already given my quiz last time. 9920015087. I've joined as a private practitioner, but I've given.
Is it Krutin?
Yes, sir. I'm Krutin, sir.
Okay, sir.
Hey, can you please just unshare the screen?
Yeah. So Krutin, now what are you doing?
I'm in second year MBBS. Sorry, like second year DNB in Arvind Coimbatore. I've given my quiz last time, sir. I just joined.
Okay.
Sir, he's the semi-finalist.
Yes, sir.
He's the first semi-final one.
Yes, sir.
So, okay. As that part of it. So
yeah,
I think,
just joined.
okay. We missed you. I missed you that part of it. So, okay. We will be, thank you for being truthful to us. We are
Yes,
going
sir.
to steal away the money back, and it will be it will go into the pocket of Dr. Shilpi, because you are not eligible in that category.
Okay,
But
sir.
you learned, and that is
Yes,
the
sir. Learned a
prize
lot.
money for more than prize money for you.
Totally.
Okay,
Thank you,
Krutin.
sir.
So
Thank you,
let's
sir.
see whether you will be in the finals of this season. Meanwhile,
Yes, sir.
Okay. And I see certain mentors as well there, Dr. Bhaskaran, Jayaprasad Bhaskaran.
Actually, I'm Dr. Smita, and
Okay.
Dr. Jayaprasad Bhaskaran is my husband, so I'm logging in through his phone.
Okay. So how was your experience, ma'am?
Yeah, it's a wonderful quiz program, sir. It's excellent.
How come you are also a avid quiz follower, or what makes you keep awake at such a late hours in the family hours?
You must be knowing Dr. Jayaprasad Bhaskaran. I am his wife, so I think both of us he's the one
Thank you.
who led me to this.
Okay. Thank you. That's quite encouraging for us. Thank you. And but why is Dr. Jayaprasad? Where has he disappeared today?
He is not here now. He was there for the quiz, but right now he's not out here.
Okay. Convey my regards to him as well.
Of course.
Thank you, ma'am. Thank you. So team 10, Venetia and Shreya. Kaisa raha bhai experience? Come on, introduce yourself.
Good evening, sir.
Good
evening, sir. I'm Dr. Shreya. Sir, I'm Dr. Vinisha. We are third year residents from Sarojini Devi Eye Hospital, Hyderabad.
And your mentor?
Dr. Afreen Kader, ma'am.
Okay, okay. So, unlike the team from Arvind who gave all the credit to Dr. Their mentor, Dr. DC, how do you look at it?
So ma'am was very supportive and helpful. She has actually helped us a lot and taught us many things throughout.
Okay, okay. So, how are you feeling the overall show about this quiz? It's enriching you, learning,
Yes,
Lot
sir.
of learning, sir.
lot of
Learning
learning.
a lot.
You better say that, because I'm the quiz host of this show. Okay, okay. Chalo, keep best of luck, and we look forward to seeing you all in the finals. But finally, all that cutting, how many people will go into the last 10 depends upon my co-host. So, if anything, if any of the teams, that's a mild, it's a serious confession that if any of the teams do not make it, blame it on my co-host. Okay. Best of luck,
Thank
Team
you,
10.
sir. Thank you, sir.
Okay. Now let's move on to Team 6. That is Samajna. What is it here? Samajna in Hindi. Where are you from?
Uh, Good evening, sir. I'm Dr. Samyak. I'm from KMC Manipal.
I'm Dr. Anjana. I'm also from KMC Manipal. So it's our names combined. We made this as a team name.
Okay. Do you know what it means in Hindi, the Samajna?
Yes, sir.
And you mean you make someone understand. So I'm wondering, as a participant, you are trying to make us understand that you are going to make a mark?
Probably.
So,
Good, 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 good. Who is your mentor, by the way, KMC?
Dr. Vijaya Pai, ma'am.
Pai ma'am. Oh, she's an avid quiz master herself, I know, and I have a deepest respect for her. Do convey my regards. Has she joined, logged in today?
I have requested her to join, Doctor.
Okay. If she joins, let me know, Sai. Hmm?
Sure.
Because your mentor used to pocket a lot of money from our quizzes, which we used to have in the previous season. That's how we know her, and we have a lot of respect for your teacher.
Thank you, sir.
Okay, best of luck.
Thank you.
Team 7 Pupil Patrol. Huh. Come on, introduce.
Good evening, sir. I am Dr. Reshma from St. John Medical College, Bangalore.
Dr. Darren from St. John's Medical College, Bangalore. Finally a resident.
So Singam, it has to be always chivalry. Remember, the ladies have to be first, or if you try to come ahead of them, they're going to push you back. So learn this, you will be happy throughout your life. Even in a married life, you will be more happy by this advice. Okay, let them be the first people. True? Married or not?
Yes. No, not married.
Not married. Okay, okay. One of the most eligible ones. Okay, good. Because it's a rare species. Now the males in the ophthalmology is a rare species. It's like males in the ophthalmology are on the verge of extinction. 95% of our postgraduates are female. True? So how many female postgraduates are there versus you male postgraduates in your institute?
In our batch, two males and
One female,
one
but then
female.
altogether 2 out of 9 are males. The rest are all females.
I hope you don't really, you should form a, organization of poor men in ophthalmology now. Okay? Chalo, best of
Yes.
luck. And who is your mentor, by the way?
Dr. Shubhashri.
Shubhashri. Has she logged in?
No,
sir.
no.
Okay, no issues. Convey her regards to her, and we would expect if your team makes it into final, she should be with us. Hmm?
Sure,
Yes,
sure.
sir, yes, sir.
What do you patrol? This pupil, how do you patrol it? Your team
We
name
check
is
pupillary light reflex, afferent pupillary defects.
Okay.
Optical function.
Gives more idea about what's happening.
Yeah, as a quiz host, I am trying to understand how I can use that particular name for creating a question for myself. That's why you didn't give me a good clue. Do text me.
Yeah,
Okay.
sure, sir. We'll get back to you. Okay.
Best of luck.
Vijaya ma'am has joined.
Bye, madam. Where is she? Ma'am, please get your video on. Which Pai madam, good evening. On हो गया?
Okay. Yeah.
Hi, good evening, ma'am. Your team
Can you
again
hear
is
me?
into semi-finals.
Yes, ma'am, we can hear you.
Thank you.
Good evening, ma'am.
Good evening.
So is it that you are contagious about winning the prizes for our quiz that rubs into your PGs?
If you think so, yes.
Because same thing is happening with DC. He's so contagious that his teams are repeatedly making it into our their PGs are making it. So I think this is a contagious disease now. Hmm? What DC, sir? No comments.
No comments.
It is, sir. It is. No. We feel happy when they grow.
Yes.
I know. I know. That's why at this hour you are with your students. You're standing behind students at this late hour, in your family hours. It speaks about your commitment for them, and definitely it rubs onto your postgraduates. And we are proud to have them. Thank you, madam, for supporting and getting your teams enrolled as well as guiding them to this particular destination.
Thank you.
Thank you, ma'am.
So
we have team.
practitioner is Parth Palans, Dr. Parth.
No, उसको आखिरी में लेंगे. अभी शादी हुई है, उसको थोड़ा रिलैक्स करने दो. Team 3 eye catchers.
Good evening, sir.
Good evening, sir.
I'm Dr.
Please.
Aishwarya from Yenapoya Medical College,
I'm
final
Dr.
year.
Saif from Yenapoya Medical College, final year.
Don't tell me it's
And
Uma.
Yes.
Who's your mentor?
Dr. Rashmi Bhatt, ma'am.
Okay. So whose eyes do you want to catch? Eye catchers means?
Oh.
What does it
Just,
mean?
we catch all the diagnosis, sir.
Okay. Oh no. So non-glamorous people, you have to at your age you should be more talking about catching not the diseases, but I think dash dash dash. Okay. Okay, do
Okay,
well. We would
Sir.
look forward to having you into one of the same into the finals. Okay. Best of luck, and do convey
Thank you.
our regards
Thank
to
you,
your
sir.
brother as well. Best of luck.
Thank you.
Thank you.
So the last team is iconic. Come on,
Good evening, sir.
बोलो भाई कहाँ से हो?
I'm Dr. Ahmad Khwaja, final year resident from GMC Aurangabad.
Good
GMC?
evening, sir.
GMC Aurangabad.
अरे क्या बात है? Good, good.
Good evening, sir. I am Dr. Vaishnavi, GR3, GMC Aurangabad.
अरे now you are making me suddenly my छाती has become 56 inch का हो गया है, 56 inches chest like Modi ji. Because first one team I am having from my own home state, that is Maharashtra. So who is your mentor?
Shubha Zawar, ma'am.
Okay, Jawar madam. She is with us.
No, she's actually out of
town.
Okay, do convey my regards to her,
Yes,
Shubha
sir.
madam.
Sure.
Okay, and wishing you all the best, and hope to see you into the finals as well.
Yes, sir. Thank you,
Thanks,
sir.
sir.
Okay, good. So Oculus Curotio. Come
Good
on.
evening, sir. Good evening, sir. I'm Dr. Uttara Bhatt. I'm a second year DNB resident from Joshi Eye Institute.
Okay.
I'm Dr. Saurabh. I'm second year student from same institute.
Okay, KP student. That's why one of our quiz masters quitted at the very last moment because he didn't want to sound be partial. Did he prepare you for it then? A frank
Yes, sir.
admission.
He has been preparing us since first day we have
Ah.
joined.
Okay. So I think
Not for the quiz, but for everything.
so I have to shift the credit to your quiz means my friend KP or to whom or to you yourself.
No,
No,
KP sir only.
all our teachers.
All our teachers.
Our mentor is Dr. Deepti Joshi, ma'am.
Oh no. Okay.
What about if they make into the finals?
Don't know, sir. Let's see.
No, but what does Oculus Curotio mean?
Actually, it's a spell from Harry Potter, which we have modified. It's actually Oculus Reparo, which we made it into Oculus Curatio.
So what is Curotio? That part I know.
Curatio is to cure any eye condition or.
Who named it, by the way? You yourself or the guy?
I mean,
I thought only the girls can only think about studies in their life, not beyond anything. While I can see the mischief in this guy's eyes. Hmm? Okay, good, good. Do play well. We are looking forward to seeing you all in the finals as well. Best of luck. Hmm?
Thank you, sir. Thank you, sir.
Thank you.
And team two is Winnie.
Good
Bhai,
evening.
introduce कीजिए. Please. Go ahead.
I'm Dr. Vidyanidhi from Patna Medical College and Hospital, Patna.
Good
Very
evening,
good.
sir. Myself, Dr. Neetu Sinha from PMCH Patna. We are second year residents, sir.
कौन है भाई आपका mentor?
Say Dr. Professor Sanjeev Kumar. He is in the panelist right now.
ओके संजीव सर आ जाइए आप तब तक हम बच्चे से बात करते हैं हमारे जमाने में व्हेन वी वर किड्स वी हैड विनी द पू करके एक लाइक यू नो सो
Yes,
डिड यू
sir.
borrow this name of the team from that particular series or what is it?
No,
It's a
sir.
It was a
combination.
Sir,
cartoon series in our time. Hmm?
it's the ship name of both of us name. It's VR for Vidya and NWE for Neetu. So it's Vinny.
Okay, for us, for me, probably DC and our age group, we will think about that particular series. You know, Winnie the Pooh. It was like Archie's
sir.
and all that.
Yes.
For your generation, I don't know what are the latest series for kids here. Shilpi, she has kids, so she might remember. Okay,
No idea.
Okay. Fine. Madam, as you said, you're Sanjeev Kumar sir. Are you there with us, sir?
Yes, sir. Yes, sir. Good evening, sir.
Sir, video on कीजिएगा. संजीव डॉक्टर संजीव साहब आप फिर से आ गए हो हमारे शो में आपकी टीम तो डे बाय डे आगे बढ़ते जा रही है
Yeah. Yes, sir. I'm very happy for that because they are doing a good job and they are very laborious also. Recently,
I know.
they went to the DOS also for Teachers of Tomorrow program.
Oh, really? Good,
Yeah,
good,
yeah.
good.
So they are doing well.
Good. I hope and see Team Winnie. I'm so happy to see hear such a kind words from your mentor, Professor Sanju Kumar. But remember one most important thing. This is not the end of the journey. This fire in the belly should continue beyond your post graduations. Okay? Then you would be rising, and that will help you in growing in life. Okay? And we
Yes, sir. Wonderful to hear from you, sir. And one thing I always used to tell my students that winning or losing doesn't matter.
Yeah.
But one thing is sure, you are teachers of tomorrow. So
True.
it's definite. So always go there, you perform, and so you will win.
No, that's what I keep on sharing with most of the postgraduate in most of the series. And at our time, we didn't have the courage to stand on the podium, leave aside. That was a
Yes,
era prayer. So, looking at your confidence, the first step is volunteering to be a part where you can sometimes be on a wrong side of the show. You might not win, but yes, that is the first step to success. First is to volunteer and to fight without fighting because of the fear of coming on the show and not able to perform well. Many a time students shy away from such shows, and in fact that is the first step towards failure. So it is very nice that you are doing so well. And I know with the mentors like DC, Sanjeev Kumar sir, Pai ma'am, and all the mentors who have been mentoring various teams, to 70 plus teams throughout the season, I'm sure we have a bright future for our ophthalmology in coming days. So best of luck, Team Winnie. Okay.
Thank you, sir.
Thank you, Professor Sanjeev Kumar sir.
Good evening, sir. Good evening.
Thank you.
It's always
अच्छा
nice to
आज
see you, sir.
थैंक
It's
यू
always
थैंक
nice.
यू थैंक यू सर तो कहाँ है भाई पार्थ आ जाओ आप प्राइवेट प्रैक्टिशनर कैटेगरी में who have all joined us साई
सर बाकी सबका हो गया सिर्फ पार्थ का ही रह गया
कहाँ है पार्थ
सर
शादी के बाद खर्चा बढ़ गया है पार्थ इसलिए आप फिर से क्विज में आ रहे हो बीवी को टाइम देने
यस सर एग्जैक्टली मैं वही बोलने वाला था इट्स बेटर
So what's on Parth? Parth has been our one of the finalists in last season. So he's recently married. Okay. So we wish the team, Brain Teaser team, wishes him a very happy married life in a short future. I'm happy that you've come in your HM days. You are with us instead of your wife. I feel to some extent pity for your wife. Parth, but good. Keep it up. Keep your zeal to participate, and you're learning like this only. Can we have a, is she along with you? We can just have a say hello to her as well.
No, sir. She's in Mumbai now. She's consulting dentist.
Okay.
And I'm here. Yes, sir. I'm not there. Long distance.
So what are you doing right now?
Sir, I'm doing fellowship, sir. Cornea Refractive Eye Foundation. I've just joined, sir.
कहाँ पे
Yes,
आई
sir.
फाउंडेशन मैंने
Coimbatore, sir. Coimbatore. Yes, sir.
ओके 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 ओके
Yes,
डन 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 सो डीसी से कुछ हिंट ले लेना भाई फिर से अब यू आर वेरी क्लोज
Yes, sir.
I'm on also XI Foundation, sir. So
Yeah.
wish you all the best. Sir, with
you,
your
sir.
permission, I would like to wish all the teams all the very best, sir.
Of course,
Because
sir.
on 25th, we have our Coimbatore Society OPL. I'll join little late. So thank you so much for a wonderful. We were learning so much. Wishing all the teams all the best and God bless.
Thank you, sir. So it's time for us to say bye-bye to each one of you, all the team members. We will be announcing shortly. Shilpi, would you like to tell the post guy this team
Most
participant?
probably within a day or two only. Give
So
us
by Friday or Saturday, you will be knowing who are the people who are making into top 10. Don't be disheartened if you don't make it to finals. As we already said some time back, volunteering and participating is the first step to success, and you have already taken that. The laurels, the prizes, the cups come and go, but your zeal, your willingness has already made you a winner, and continue this particular trait of yours of participating, fighting for yourself, for your subject, and that will lead you to the ultimate success in your life, not only on professional front but on all fronts. So wishing you all the best. So we will be meeting on following Wednesday for the finals of this particular season. Till then, it's time for us to sign off. Bye bye everyone. Parth, बाद में बात करते हैं आपसे. Bye bye.
Okay, bye. Good night. Thank you, sir.
Night.
Thank you.
Good night.
Good night, sir.
Good night.